Hello, my name is Christopher Van, and I serve as the Vice President of Development for CommWell Health, a federally qualified health center providing primary medical, dental, and behavioral health services in southeastern North Carolina. On behalf of the colleagues of CommWell Health and the authors of this poster, it is my pleasure to present to you Unleashing Health Center Excellence, an organizational blueprint for evidence-based leadership. The need or problem that was addressed in this implementation is one that is experienced by health centers and healthcare organizations across the United States. The COVID pandemic of 2020 and 2021 has driven burnout among healthcare workers to crisis levels, which has led to greater dissatisfaction and turnover, and requiring systemic solutions to retain the organization's greatest asset, its people. Health centers that desire to thrive as high reliability organizations post-pandemic must implement sustainable, intentional, and evidence-based leadership blueprint designed to engage and empower all colleagues in culture, quality, finance, and governance. The work in culture, quality, finance, and governance would be measured by key performance indicators for which data is collected, analyzed, and utilized to improve health center operations each and every day, because our excellence tomorrow is truly greater than our excellence today. The goals of this project are fourfold. In culture, which we define as people, both patients and colleagues, we strive to be an employer and a provider of choice, and an organization that actively and intentionally supports diversity, equity, and inclusion. In quality, which we define as systems, we strive to meet and exceed national benchmarks and standards of integrated patient-centric care. In finance, which we define as our resources, we strive for sustainable benchmarks and thriving metrics in finance, so that the organization is not only surviving, but truly thriving in its work. And finally, in governance, which we define as accountability, high reliability operations that exceed regulatory standards. The design of the project utilizes a culture blueprint based on the 3-3-3-1 principle, which is a focus on 4 areas of organizational operations, which are known as trees of transcendence. They are culture, quality, finance, and governance. Colleagues devote 30% of their daily work to culture, 30% of their work to quality, 30% to finance, and finally 10% to governance. Culture is prioritized first as a foundational element, which is critical to the success of the operations and the other 3 trees of transcendence. Because as someone once quoted, culture eats strategy for breakfast, lunch, dinner, and every meal in between. No operations are successful without its people. This blueprint that we're utilizing is known as Eagle Excellence at CommWell Health. Next, as part of the project implementation, the first step to establish this blueprint, we identified a culture champion. This is an individual within the organization, either committed part-time or full-time, who manages the culture development initiative. This is strengthened by an organizational culture council, which is developed and represents a cross-section of the organization, including the board of directors. This includes leadership, also middle management, clinical staff, and frontline staff. Next, volunteers in the organization, individuals who are seen as the cream of the crop, individuals who are doing exceptionally well in their work, are selected as culture excellence advisors and trained to help facilitate a colleague development curriculum inside the organization. This becomes a pipeline for succession planning as these colleagues participate in various levels of this culture initiative between 4 and 8 years. Next, quarterly all-staff personal and professional workshops are facilitated by these culture excellence advisors, which we call Soaring Eagles at CommWell Health. These Soaring Eagles facilitate mandatory workshops or masterminds, as they're called at CommWell Health, on topics such as empathy, on personality identification, working in teams, all designed to help build and enhance multidisciplinary collaboration. Finally, bi-monthly provider and leadership personal and professional development masterminds are held discussing leadership topics such as team development, crisis management, conflict management, utilizing our strengths, and other such topics to help build and develop individuals personally and professionally. The project outcomes have been meaningful, sustainable, and have shown significant improvement over the last several years since the implementation of this blueprint. In culture, overall colleague satisfaction has increased from 76% in 2013 to 98% in 2021. Clinical measures have seen significant improvements in quality. For example, depression screening, which is a UDS measure, increased from 16% in 2015 to 89% in 2021. In finance, net assets for the organization have grown from less than $1 million in 2009 to over $22 million in 2022. And finally, in governance, during the last operational site visit with the HRSA Bureau of Primary Healthcare, the organization experienced 100% compliance with health center requirements. Challenges or lessons learned: the organization requires a strong commitment to its mission, vision, and values, and a behavioral code of ethics. A 2-year personal and professional development preparatory training session was created to create momentum for colleagues seeking growth opportunities and succession planning. The Culture Council must include representatives from all levels of leadership and frontline staff, including the board of directors. And finally, each year, to ensure that our excellence tomorrow is greater than our excellence today, we conduct an annual culture audit to ensure accountability and commitment by colleagues in leadership to the culture initiative. I would like to personally thank our poster authors, Pam Tripp, CEO, Tammy Dunn, CNO and COO, Cheryl Stanley, our Chief Financial Officer, Sarah Parker, our Chief Talent Officer, Karen Smith, our Chief Quality Officer, and Regina Gainey, our Eagle Excellence Culture Manager. Thank you for listening.